Okay, so this is the room I'm in. And there is my visual aid over there. Okay, so my patient is a 20-year-old white male. I just got done washing my hands. Hi, my name is Kelsey Dumas. I'm a student nurse at UAM, and I'm here to do a history and physical assessment for some homework, if that's okay with you.
That's fine with me.
Okay, before we begin, would you like to use the restroom?
No, I'm okay.
Okay, so what brought you here today?
I have been having shoulder pain.
Okay, and when did you first notice the shoulder pain?
It started about a week ago.
Okay, is it the right or left shoulder?
It is my left shoulder.
And does the whole shoulder hurt, or is it just a certain area?
No, my entire shoulder.
Okay, and how would you describe the pain? Is it dull, throbbing, or like a sharp pain?
I would say it is more of a dull pain.
Okay, and is the pain constant, or does it come and go?
No, it comes and goes.
Okay, does it happen daily?
Yes, it's happened every day since it began.
Okay, and so how many times per day?
Usually about 2 or 3.
And for how long at a time?
Anywhere from 30 minutes to an hour or hour and a half.
And have you experienced any other symptoms along with it, or just shoulder pain?
No, just the shoulder pain.
And could there have been any recent trauma or injury that could cause the shoulder pain?
No.
Okay. Have you tried anything that makes it better?
Ice and rest.
What about anything that makes it worse?
It tends to get worse when I go to the gym if I do any kind of pushing exercise that requires me to strain my shoulder.
Okay, and how often do you go to the gym per week?
6 days a week.
And what type of exercises do you do?
Strength train 5 days a week, and I do high intensity cardio 1 day a week.
Okay, and have you tried any medications?
No, I have not.
Okay, and if you had to rate your pain on a scale of 1 to 10, with 10 being the absolute worst, how would you rate your pain?
I would say a 6.
Okay, so now I'm going to move on to a couple questions about your past medical history. Did you have any major illnesses as a child?
No, I did not.
Okay, and do you currently have any major illnesses?
I do actually. I am a diabetic.
Okay, and is it type 1 or type 2?
Type 1.
Okay, and do you use insulin injections or a pump?
I am on a pump.
Okay, what type of pump do you use?
Currently with Omnipod.
And do you visit your endocrinologist regularly?
Yes, I do.
Okay, perfect. Are you staying up to date with all your immunizations?
Yes.
Do you know the date of your last tetanus shot?
Can't give you an exact date, but I know it was within the past 6 months.
Okay, that's fine. And did you get your flu shot this year?
Yes, I did.
Perfect. Have you had any serious injuries or hospitalizations?
No.
What about surgeries or transfusions?
No.
Do you know the date of your last health exam?
A couple months ago.
Okay, and are you staying up to date with all your screenings?
Yes, I am.
Great. Are you currently taking any medications?
No.
And is there any food, drug, environmental allergies that you have that you're aware of?
No.
Okay, and do you have any mental health or psychiatric disorders such as schizophrenia, depression, or anxiety?
Nope.
And have you had any recent labs or diagnostic tests done?
Actually, I had an A1C drawn about 2 or 3 months ago.
Okay, and what was it?
I believe it was a 6.9.
Okay, that's good. Now a few questions about your family history. Has anyone in your family ever had any type of cancer, high blood pressure, heart disease, arthritis, or any type of mental illness?
No.
What about any diabetes, tuberculosis, stroke, or epilepsy?
Diabetes.
And who in your family has it?
My grandfather and my younger brother, and then myself.
And how old are they?
My younger brother is 18 and my grandfather is 80.
Okay, and are they both also type 1 or type 2?
They're both type 1 as well.
Okay, and has anyone in your family ever had any type of liver disease, kidney disease, thyroid disease, lung disease, or any asthma or allergies like that, anything like that?
Nope.
Okay, now a few questions, like personal and social questions for you. Where were you born?
I was born in El Dorado, Arkansas.
Okay, and what was your home life like growing up? Did you live with a single parent, both parents, or somebody else?
I lived with both of my parents and my younger brother.
Okay, are you married or do you have a partner?
I do have a partner, but we're not married.
Okay, do you live with this partner?
No, I live alone in my apartment.
Okay, what is your current job?
I currently work part-time for a fence company.
And what is your highest level of education?
I graduated Crossett High School, and I am currently in my junior year of college.
Do you have any hobbies that you enjoy doing?
Yes, working out and anything outdoors like hunting or fishing.
Okay, and do you wear sunscreen while you're outdoors?
Yes, I do.
Great. Do you drink alcohol, use tobacco, or any other type of recreational drugs?
No.
Okay, and what is your caffeine intake like? Do you drink a lot of caffeinated beverages or coffee?
No, I drink pretty much just straight water.
Okay, and are you on any type of special diet?
Nope.
Okay. Have you recently traveled outside of the country?
No, I have not.
Okay, do you have any spiritual preferences or cultural requirements that I should be aware of?
I do not.
Okay, are you performing self-testicular exams regularly?
Yes, I do.
Do you go to the eye doctor?
I do, once a year.
Okay, what about the dentist?
I go to the dentist twice a year.
Okay, great. And do you have any concerns regarding your sexual life?
I do not.
Are you sexually active?
I am.
Do you use protection?
Yes, I do.
And have you or do you have any STIs?
No.
Okay, good. So how would you describe your overall general health status?
I would say I'm pretty healthy considering as much as I work out and how active I am even when I'm not at the gym with work and just activities of daily living. I'm pretty active.
Okay, good. Do you have any dryness, itching, rashes, or lumps in your skin?
No.
What about any changes in color, texture, or any sores that won't heal?
Nope.
Okay, and any excessive sweating?
No.
Perfect. Have you had any changes in hair loss, growth, distribution, texture, or color?
No.
And do you use any chemical hair care products?
I do not.
Okay. Have you noticed any discoloration, thickening, or breakage in your nails?
No.
What about any brittleness, infection, or separation from the nail bed?
Nope.
Any unusual markings, ridging, or splitting?
No.
Okay. Any loss of consciousness, head injuries, or dizziness?
Nope.
Any pain, swelling, headache, or fainting?
No.
Okay. Any vision changes such as blurriness, double vision, or light sensitivity?
Nope.
Do you wear glasses or contacts?
I do not.
And have you had any pain, itching, or swelling in either of your eyes?
No.
Okay. Do you use any hearing aids or assistive devices?
No, I do not.
And have you experienced any dizziness, earaches, ringing of the ears, or ear loss, hearing loss?
No, I have not.
Okay. And move on to the nose. Have you experienced any congestion, sinus pain, itching, or sneezing?
No.
Any changes in smell, obstruction of the nose, or discharge?
Nope.
And do you have nosebleeds or do you snore?
No, I do not.
Okay. Have you had any dental issues such as loss of teeth, pain, or grinding?
No.
Do you use dentures or any other type of appliances?
No, I do not.
Any changes in taste, soreness, difficulty swallowing, or difficulty chewing?
No, none of the above.
Any hoarseness, dryness, ulcers, or bad breath?
Nope.
Okay. Any enlarged, tender, or pus-forming lymph nodes?
None.
Okay. Any shortness of breath, coughing, chest pain, or night sweats?
Nope.
Any changes in the color, consistency, amount, or odor of sputum?
Nope.
And do you know when your last chest x-ray was?
I know it was definitely within the past year.
Okay. Do you have any pain, tenderness, lumps, or discharge from your breast?
No.
And are you performing self-breast exams regularly?
Actually, I'm not.
Okay. Have you had any swelling in your extremities, clammy skin, or palpitations?
No, none of the above.
What about any shortness of breath on exertion or chest pain?
No.
Any night sweats?
No.
Okay, and how many pillows do you sleep with at night?
I usually sleep with one pillow.
And what is your exercise tolerance like for walking up a flight of stairs or distance walking?
I can do either of those with ease.
Okay. Do you experience any pain, abnormal pain in your legs during physical activity?
No, I don't.
Do you bruise or bleed easily?
No, I do not.
And have you had any issues with any varicose veins or blood clots?
No.
Okay. Are you anemic, or do you have any other type of blood disorder?
No, I don't.
Okay, good. Have you experienced any nausea, vomiting, diarrhea, or constipation?
No.
What about any gas or indigestion?
Nope.
Okay. Any changes in stool characteristics like the color, frequency, or consistency?
No.
Any changes in appetite?
Nope.
Okay. Any pain, itching, bleeding, cramping, or difficulty swallowing?
No.
Are you vomiting blood? Do you have the inability to control your bowel movements?
No.
Any hemorrhoids, tumors, polyps, ulcers, or gallstones?
Never had any of those.
And have you ever had a colonoscopy?
I have not.
Okay. So, have you had any enlargement or tenderness in your front neck area?
No.
What about any unusual weight loss or gain?
Nope.
Have you become intolerant to hot or cold temperatures?
I have not.
Any increased urination or increased thirst?
No.
And have you had any change in your hat or glove size or distribution of facial or body hair?
No, I don't believe so.
Okay. Have you had any painful, dark or discolored, or bloody urine?
I have not.
Any frequency, urgency, burning, or difficulty initiating or maintaining urinating?
No.
Any loss of force of stream, dribbling, or increased urination at night?
Nope.
And what about the inability to control urination or STIs?
No.
Okay. So when did you first hit puberty?
I believe I was about 12.
Okay. And do you have any troubles with getting or keeping an erection?
No.
Do you have any testicular pain or discharge?
No.
Infertility or changes in sexual desire?
Nope.
Okay, good. Have you had any joint pain, stiffness, or limitation in movement?
None other than the joint pain in my shoulder that I'm here for today.
Okay. And any redness, swelling, heat, or bony deformities?
No.
Okay. Have you had any seizures, tremors, paralysis, weakness, or fainting?
No, I have not.
What about any abnormalities of sensation, coordination, or loss of memory?
Nope.
Okay, and have you had any of the following? Depression, anxiety, mood changes, sleep disturbances, or any suicidal thoughts?
No.
And what about any irritability, agitation, tension, or the inability to concentrate?
Nope.
Okay, and is there anything else you'd like me to know about you?
I don't believe so.
Okay, so now I'm going to move on to the physical assessment part. So I'm looking at the skin. Color is nice and uniform throughout. There's no abnormal moles or lesions. No dryness or cracking, and no redness or any signs of infection. Everything looks good. So now I'm going to palpate the temporomandibular joint. I'm going to get you to open and close your jaw for me. Okay, and now move it side to side, your bottom jaw. Now front and back. Okay, so no clicking or grating sensation upon palpation of the temporomandibular joint. So now I'm going to feel of your jaw muscle. So can you clench your teeth for me? Okay, so cranial nerve 5 trigeminal is intact per bilateral jaw muscle tone. So now I'm going to palpate and compress the sinus region. So let me know if you feel any pain or tenderness.
Okay.
Okay.
Nope.
No pain or tenderness upon palpation of and percussion of sinus region. So now I'm going to get you to do a few facial expressions for me. So can you raise your eyebrows? Can you squint your eyes shut? And wrinkle your forehead? Can you smile with no teeth? Smile with teeth? Purse your lips together? And can you puff your cheeks out? Okay, so patient was able to do all facial expressions with ease. So cranial nerve 7, facial is intact per facial expressions. So now moving on to the eyes, looking at the eyelids. Color is nice and uniform throughout. There's no abnormals or lesions, no cracking or any redness in the palpebral folds, no signs of any infection or styes within the eyelash area, and the eyebrows are nice and symmetrical. So now I'm going to palpate these eyelids. They're nice and smooth, no abnormal texture, no swelling, and no masses or lumps. So that's all good. Now I'm inspecting the sclera. It's nice and white. There's no discoloration like erythema or jaundice. The iris is there's no discoloration there. It's a nice, good, uniform color throughout. Looking at the cornea, it's nice and clear. There's no cloudiness. So now I'm going to pull your eyes down and look at your conjunctiva. So can you look up for me? Okay. Conjunctiva is nice and pink. There's no signs of any irritation like redness or drainage. So now I'm going to test this near vision. Can I get you to hold this 14 inches away from your face? And cover one of your eyes, whichever one you want to start with. And read from left to right the smallest number that you can, smallest line.
4, 2, 8, 7, 3, 9.
Okay, now switch it to the other eye and read it from right to left instead.
9, 3, 7, 8, 2, 4.
Okay, so patient was able to read to 20/20 on both eyes easily. So cranial nerve 2, optic nerve, is intact per Rosenbaum near vision chart test. So now I'm going to test your corneal light reflex. So what I'm going to get you to do is look right here at this light for me. Okay, corneal light reflex is equal bilaterally. Now I'm going to get you to watch this pen as I move it, but don't move your head, just move your eyes. Okay, so there's no involuntary shaking of the eyes. So cranial nerve 3, oculomotor, 4, trochlear, and 6, abducens are intact per extraocular eye movements. So now I'm going to measure your pupil size according to this chart. Looking at them normally, they're about a size 4, so that's good. I'm going to check your pupillary response to light with the lights off. So first I'm going to check it directly in this eye. Okay, direct constriction. Now I'm going to check it consensually in this eye. Okay, consensual. Now this eye directly. Okay, direct. Now this one consensual. Okay, so that's all good. Now I'm going to get you to look at that dot on the wall, and I'm going to get you to switch your gaze from there to there when I tell you to go. Okay, go. Okay, so pupils constricted, and so the cranial nerve 3, oculomotor, 4, trochlear, and 6, abducens are intact for accommodation, and pupils are equal, round, reactive to light, and accommodation. So now moving on to the ears, I'm going to put this down. Okay, so looking at the ears, very nice and a good uniform color throughout. There's no abnormals or lesions, no redness or swelling, and no drainage. So that's all good. Now I'm going to palpate your ears. Let me know if you feel any tenderness. Any tenderness?
Nope.
Okay, so no pain or tenderness upon palpation of the ears, no masses or lumps, and no heat felt. Now I'm going to do a whisper test. So what I'm going to get you to do is plug your right ear, and I'm going to stand off to the side. I'm going to whisper a few phrases for you. You're going to repeat them back to me, and I'm going to do it on the other side.
Okay.
So plug your ear.
Red, yellow, orange.
Okay. And your other ear.
Blue, purple, pink.
Okay. So the patient was able to repeat back the 3 words on both sides. So cranial nerve 8 acoustic is intact per whisper test. So now moving on to the nose. Can you look at me? Nose is nice and midline. Can you look up towards the ceiling? Okay, so the layers are nice and symmetrical. There's no deviation of the septum and everything looks good. So now can I get you to look back at me? And can you plug one side of your nose and breathe in? Okay, now the other side. Okay, so I can hear airflow for both nares, so they're nice and patent. Now I'm going to move on to the mouth. And inspecting the lips, they look nice and pink. There's no dryness or cracking, no normal lesions, and everything looks good. So now can I get you to open your mouth for me? Okay, looking at the cheeks, they're nice and pink. There's no abnormal lesions, they're nice and moist. Can you lift your tongue up for me? There is no signs of any oral cancer or any other types of lesions. Nice pink and moist on the floor of the mouth. Now can you put your tongue down for me? Okay, and I'm going to put your tongue down. Okay, so the uvula is nice and midline. There's no redness or swelling or any abnormalities of the tonsils. And the ornopharynx is a nice color. There's no lesions present there. I'm going to look at the hard and soft palate. Nice and pink. There are no abnormal lesions or any discoloration. There's no abnormal mouth odor or anything like that. No bad breath. Now can I get you to smile for me? Okay, so looking at the gums, they're nice and pink, and they're tightly bound to the teeth. And looking at the teeth, they're nice and white. And there are no dental caries or any broken teeth or any abnormalities like that. So now can I get you to stick your tongue out for me? Okay, looking at the tongue, it's nice and pink and moist. There's no dryness or cracking present. And there's no signs of any thrush. Can you move it side to side for me? Okay, so a patient can do that with ease. Cranial nerve 12, hypoglossal, is intact. Can I get you to swallow for me? Okay, patient can also swallow with ease. So cranial nerve 9, glossopharyngeal, is intact. And can I get you to open up your mouth one more time and say ah? Okay. So uvula is nice and midline. So cranial nerve 10, vagus nerve, is intact. Now moving on to the neck. Looking at it, it's nice and smooth and symmetrical. Trachea appears nice and midline. There's no jugular vein distension. There's no abnormal color. It's a nice uniform color throughout. And there's no abnormal moles or lesions. So now I'm going to check your neck range of motion. Can I get you to bend your head down? Flexion. Now lift your head all the way back and look at the ceiling. Hyperextension. Now tilt your head to the right. And now to the left. And that's lateral bending. And now can you turn your head to the left? And to the right. Okay, rotation. So now I'm going to test all of them against resistance. So I just want you to push against my hand. Push down. Flexion. Now hyperextension. Okay, and lateral bending. Okay, now this side. Okay, lateral bending. Rotation. Okay, and now this one. Okay, so cranial nerve 11, spinal accessory, is intact per appropriate strength and full range of motion. Now can I get you to shrug your shoulder for me? Now against resistance. Okay, so patient was able to do that with ease. So cranial nerve 11, spinal accessory, is intact per appropriate strength and shoulder shrug. So now I'm going to palpate your carotid pulses. Start with this side. Okay, and now this side. Okay, carotid pulse is equal bilaterally. Now I'm going to palpate trachea. and trachea is nice and midline. There's no masses or lumps, and it is freely movable. Now I'm going to palpate your lymph nodes in your neck. So back here is the occipital, postauricular, preauricular, right here that way a little bit, tonsillar, submaxillary, and submental. So now I'm going to do the anterior cervical and the posterior cervical and the supraclavicular. Okay, so no tenderness or pain upon palpation of all the lymph nodes and the head and neck, and they were non-palpable, so that's good. So now I'm going to move on to the upper extremities. So can I get you to put your arms out for me? Okay, so looking at the skin, it's a nice uniform color throughout. There's no tattoos, no abnormal moles or lesions, no redness or dryness or any signs of any infection. Nice smooth texture, the hair distribution is symmetrical, that's all good. So now I'm looking at the hands. There's no cracks or any lesions in between any of the fingers. On this hand, now I'm going to check this hand. Okay, all good. Looking at the nails, there's no signs of any infection, no unusual markings, ridging or splitting, anything like that. They look good. So now I'm going to check your nail angle. So what I'm going to get you to do is put your nails together like this. Okay, so normal nail angle, so there's no signs of any clubbing, that's good. Now I'm going to test your capillary refill. So I'm going to start with this hand. Just going to push down on all your fingers. Okay, this hand. Okay, so capillary refill took less than 2 seconds, so that's normal, everything's good. Now I'm going to palpate your radial and brachial pulses. So I'm going to start with your radial on this hand. Okay, now let me see the other hand. I'm checking the radial on this side. Okay. Radial pulses are equal bilaterally. Now I'm going to check your brachial pulse. Okay, now the other side. Okay, so brachial pulses are equal bilaterally. Now I'm going to palpate your epitrochlear nodes. Now the other side. Okay, now axillary, I'm going to start with this side. Put your arm up a little bit for me. I'll hold it for you. Okay, that's good. Now this side. Okay, no tenderness or pain upon palpation of epitrochlear and axillary nodes, and no nodes were palpable, so that's good. Now I'm going to do your range of motion in your hands, wrists, shoulders, and elbows. So I'm going to get you to stick your arms straight out for me. Can you put your arms down for me, your hands down? Okay, that's flexion. Now back to the middle, extension, and up towards the sky. Hyperextension. So, and can I get you to do your fingers in a ball for me? And your fingers out. Okay, good. Now I want you to turn your arms like this and come back and touch your shoulders. Flexion, and now go back out. Extension, good. Now I'm going to get you to put your hands behind your back, external rotation. Behind your head, and then back behind your back. Internal rotation, and can you put your arms all the way up? Flexion, and all the way back. hyperextension. Okay, so now I'm going to test all of those with resistance. So can I get you to put your arms back out straight for me? And go down, flexion, now to the middle, extension, and all the way up. Hyperextension, now do back over. Now I'm going to get you to go back, flexion. Okay, and now towards me, extension. And now do your arms up for flexion of the shoulders. Okay, and now back in hyperextension. Okay, so now limitations in range of movement of the hands, wrists, shoulders, and elbows, and they all have appropriate strength, so that is good. Now I'm going to move on to your back, so can I get you to take your shirt off for me? And would you like to be draped for privacy purposes?
I'm okay.
Okay, so can I get you to turn that way for me just a little bit? Okay, so looking at the back, there's no abnormal moles or lesions. It's a nice uniform color throughout. Shoulders are nice and symmetrical. No musculoskeletal abnormality, so everything looks good. So now I'm going to test your tactile firmitis. So can I get you to say 99 for me?
99.
Again.
99.
And again.
99.
Okay, now deep breath in and out for me. And let me know if you feel any tenderness.
No.
Okay, so posterior tactile firmitis and thoracic expansion are equal bilaterally, and there's no costovertebral angle tenderness. So that's good. Now I'm going to listen to your breath sounds on your back. Okay, so can you take a deep breath in and out for me? Again. 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 And again. Now can you lift up this arm for me? Deep breath in and out. Now this arm. Deep breath in and out. Okay? So breath sounds are nice and normal. There's no signs of any crackles or wheezings or any abnormalities like that. So that's all good. Now can you turn around and face me? Okay, so looking at the chest, clavicles are nice and symmetrical. There's no abnormal moles or lesions, no tattoos. Nice and uniform color throughout. No abnormal masses or lumps. And the respirations are normal in depth, rhythm, and pattern. Good posture, no signs of any respiratory distress or any use of accessory muscles to breathe. So now I'm going to palpate the chest wall. Okay, so chest wall is nice and stable. There is no tenderness and no crepitus found. So now I'm going to do the same thing on the front. Get you to say 99 straight through tactile firmitis.
99.
Again.
99.
Again.
99.
Okay. And can you take a deep breath in and out for me? Okay. So anterior tactile firmitis and thoracic expansion is equal bilaterally. Now I'm going to listen to your breath sounds on the front. Deep breath in and out for me. Again. 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 And one last time. Okay, so breath sounds on the front are nice and normal. There's no signs of any cracking, any wheezes, or anything abnormal like that. So now I'm going to listen to your heart sound. So I'm going to get you to lean forward for me a little bit. Okay. Okay, so I'm checking his aortic first. Okay, good. Now pulmonic. Second pulmonic. Tricuspid. And mitral. Okay, so heart sounds are good. I could hear easily S1 and S2, and there's no murmurs or gallops, so that's all good. Now I'm going to ask you to lay down so I can check out your abdomen. Okay, and yeah, keep your knees up like that. So looking at the abdomen, it is nice and symmetrical. There's no tattoos or any discoloration, nice uniform color throughout. No abnormal or lesions, nice flat contour, and there's no signs of any infection around his pump site. So now I'm going to listen to all 4 regions for bowel sounds, and I'm going to listen over the aortic, the abdominal aortic for a brewing. So I'm starting down here. Okay, now I'm moving up. Okay, now to the other side. And last place. And now I'm listening for a brewy. Okay. Bowel sounds are active in all 4 quadrants, and there was no brewing, so that's all good. Now I'm going to lightly palpate in all regions. Let me know if you feel any pain or tenderness while I'm palpating. Going in a clockwise motion, making sure to feel of all the regions. Okay, any pain or tenderness?
No.
Okay, great. So there's no pain or tenderness upon palpation of the abdomen, and there's no masses or lumps found. Now can I get you to lift your head up for me? Okay, and no protrusions, nice muscle tone, and there's no signs of any hernia. So that's good. Now I'm going to get you to lean all the way back here and stretch your feet out. And I'm going to take off your shoes if that's okay with you.
That's fine.
Okay. So, looking at the legs, I'm going to move your legs to the sides just to make sure I can see all of it. Okay, now this leg. Okay, so nice uniform color throughout. There's no abnormal moles or lesions, no redness or any dryness found. There is no abnormalities. Hair distribution is symmetrical on both sides. No varicosities or anything like that. So now I'm going to palpate. Let me know if you feel any tenderness. I'm just feeling for texture and temperature and swelling, and there are none in this leg, no swelling, nice normal smooth texture, no abnormal texture, no heat or redness found. Okay, and no swelling in this leg either, nice normal texture and no heat. So now I'm going to test your capillary refill in your toes, and I'm going to check out down here, looking at the feet. There's no redness or abnormal moles or lesions, no dryness. Now I'm going to check in between the toes for any lesions or cracking or anything like that that can't usually be seen, and these all look good. Nails, there's no ridging or splitting or anything like that. No infection. They look good. So now I'm going to this leg, and these, looking in between the toes, no dryness or cracking in between them, no lesions, and these toenails are also nice and normal, no ridging, splitting, or any abnormalities. So now I'm going to look at the bottom of the feet, and there's no sores or pressure ulcers or any excessive wear, so that's good. And I'm going to test your range of motion of your feet. So can I get you to point your toes down here towards me? Plantar flexion, and back towards you, dorsiflexion. Okay, and now I'm going to get you to do it against resistance, so down towards me, plantar flexion, and up towards you, dorsiflexion. Okay, great. So no limitations in ankle and foot range of motion and appropriate strength. Now I'm going to get you to sit up for me. Okay. So now I'm going to test your superficial touch sensation with this cotton ball. So this is what it feels like. Okay. So what I'm going to do is I'm going to put it in different areas of the body, and I'm going to get you to close your eyes. And when you feel it, you're going to say now.
Okay.
Okay. Close your eyes.
Now. 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 Now.
Okay, so that's all good. Now I'm going to do the same concept, but with this paper clip. So I'm going to either get you to say either sharp or dull. So this is what it feels like, sharp, dull, and in a different area, sharp and dull. So can you close your eyes for me? Okay, so just tell me whether it's sharp or dull.
Sharp.
Okay,
Dull.
okay,
Dull. Sharp. 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 Dull. Dull. Dull.
okay. So trigeminal cranial nerve 5 is intact per superficial touch sensation and sharp dull test. So now I'm going to get you to do something for me. It's called lap pat test. So what you're going to do is put your hands in your lap with your palms down, and then you're going to flip them over and then back over. And you're going to count down from 10. So it's going to be like this. 10, 9, 8, 7. Okay? So you go when you're ready.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay, perfect. Now we're going to do something called finger-to-finger test. So can I get you to choose whatever finger you want to and put it on your nose? Okay, and I'm going to hold my finger out here, and you're going to switch from your nose to touch my finger and then go back to your nose. And I'm going to move my finger around, and you're just going to follow my finger with your finger and then go back to your nose. Okay?
Okay.
So go when you're ready. Okay, so proprioceptor and cerebellar function are intact per lap pat test and finger-to-finger test. Okay, so here's your shoes. I'm going to get you to stand for me, and I'm going to move this table out of your way. Okay, so what I'm going to get you to do is walk heel to toe 10 times back that way, and then walk back 10 steps back normally to me. And there's no loss of balance or coordination, so That's all good. Now I'm going to test your balance. Can I get you to stand on one foot for me? Okay, and now switch. Okay, you can put it down. So no loss of balance or coordination. So standing on one foot, you can do easily. Good balance. Now I'm going to test your Romberg balance. I'm going to get you to do a little test where you put your feet together. And you're going to put your arms out. And close your eyes and tilt your head back. Okay, no loss of balance. Everything's good. So now I'm going to test I'm going to look at your spine. So can I get you to turn towards that wall and bend down? Okay, so feeling of the spine. Nice, and midline, there's no curvature. Everything's good. So now you can sit back up. I'm going to test your spine range of motion. So can you bend down towards the ground? Flexion. And now bend way back. Hyperextension. Okay, now go to the side. Lateral bending. And now the other side. Lateral bending. And can you rotate to the right? And then rotate the other way. Okay, no limitations in spine range of motion. This concludes my physical assessment and history. So thank you for participating.